Hi, everybody. I'm Laura with Kansas City Mom Collective, and today I'm with Dr. Christina Low Kapalu from Children's Mercy Pediatric Gastroenterology. So, the GI clinic at Children's Mercy, which I've actually had a lot of experience with. My kids, my two boys, were treated for acid reflux. And so I saw doctors in the GI clinic, and they were extremely helpful. So I can give my personal endorsement on that one. But today we're talking about a different topic. We're talking about constipation in kids. And so we're going to go ahead and just get started, ask you some questions and see how we can help our moms avoid that constipation in kids. So first off, what exactly constitutes constipation? Like, how infrequently are we talking?
Yeah. And thank you for having me today. So it kind of varies. I think people want a specific number. If we look at the Rome diagnostic criteria for older toddlers and kids, we're talking 2 or fewer bowel movements a week being considered constipation, but that's just one piece of it. Constipation is large, hard, infrequent, or difficult to pass stools. So you can technically be pooping more often and still be constipated. That's why I say it kind of depends. We'll often hear parents, or even with my own kids when they were infants, I'm like, they haven't pooped in 5 days. Is that normal? And the doc said yes. And a lot of our docs will say yes. And so it's not necessarily about a specific number, but it's a range of symptoms. So 2 or fewer poops per week, yeah, maybe you should talk to your doctor. If they have straining with pooping, if they have pain, or if they are having very big stools that look uncomfortable to pass, all of that could be constipation, in addition to not pooping frequently enough.
Gotcha. Okay. So we mentioned kind of babies and toddlers, and I know like they ask a lot of those questions at the pediatric visits, but does it affect kids of all ages?
It absolutely does, right? That first year or 2 of life as a parent, you track things religiously. How many times did they eat? How many times did they poop? How many wet diapers did they have?
I found my notebooks.
Exactly. I mean, they have apps for them. They have so many different things. But after that age, you really stop tracking. And you see constipation fairly commonly across the entire age range. So about 18% of toddlers and about 14% of children and teens are constipated. So it's not just an infant and toddler problem.
So as a follow-up question to that is, what are some signs like we should be looking for? And so do we ask our big kids how often they're pooping or what their poops look like?
Absolutely. Yeah. A lot of families are very open about those conversations and some are not. I think we want to err on the side of giving our kids age appropriate privacy. But if we start to see some signs or symptoms that are less common, we may want to ask about it and just ask if they're having any discomfort. So the most common questions doctors will ask is, how often do you poop? Does it ever hurt if you poop? Do you have any blood in your poop? Because that's a concern. Do you have any belly pain? And when you do have belly pain, is it better after you go to the bathroom? Because if it is, that may be an indication that you're constipated. I often have parents come in and say, my baby has, or a toddler has a pretty bloated belly, and they just look like they might have little pregnant bellies. That could be a sign of constipation as well. Or if they have decreased appetite and no viral illness symptoms, you go, I wonder why they're not as hungry. Some of the later warning signs that we may want to be aware of as well in older kids that are kind of downstream effects of constipation are if they have new onset wetting, like all of a sudden they're having wetting accidents. You may want to say, okay, is that constipation? If they're having nausea or vomiting, again, without viral illness symptoms, and just say they feel really full and not eating and not pooping as well, those could be signs of constipation. So there's a wide range of symptoms that could happen. And it's not just asking them whether or not they pooped, but do they have all those other things? And if they have some of those other symptoms and they're older, you might question or wonder out loud, when's the last time you went to the bathroom? And was it hard to go?
Okay. So let's back up. Why does constipation happen at all? I mean, if we're continuing to eat, why doesn't it come out?
Absolutely. And I think that's the big question parents want to know is whether or not, why their kids constipated, because they drink adequate fluids and they eat adequate fiber and an adequate diet. We don't always know. The most common reasons for constipation or functional constipation is when there's no anatomical or biological reason for constipation. It's just the poop isn't coming out as often as we would like. In toddlers, that's often related to stool withholding. So you start to toilet train and they say, nope, don't want to do this, and decide I'm not pooping anymore. The longer it stays in your body, the more water's pulled out, the harder it gets, the more difficult it is to pass. And you just repeat that cycle. Well, that was uncomfortable. I'm not going to do that again. You can see that in older kids and teens as well. Like, I don't want to go to the bathroom at school, so I'm going to wait till I get home. But that waiting causes more constipation. You can also see it related to dehydration. So this is more important for kids who are not getting adequate hydration, not adding more fluid for kids who are already getting what they need. Same thing with insufficient diet. If a kid is eating 4 foods and they're all beige, constipation may be related to dietary deficiencies. But if they eat a varied diet, generally speaking, adding more fruits and vegetables, if it's a chronic issue, is not going to fix it. So lots of reasons. And also transition to school. Kindergarten is one of the times we see a big ratcheting up in constipation. That transition is world rocking for a lot of kids. And we'll see constipation develop as a result of that.
Yeah, I often wonder, my daughter started kindergarten this year, and I keep asking her, when do you poop? Because I used to know her schedule because she was home with me, and now I don't. And I'm like, I don't know. Does she go at school? And I worry because she's one that always has those little like balls. She's never been like, so I do wonder. So that's interesting that kindergarten does start that. I'll have to keep them more of an eye.
And it can sneak up on you because you don't really talk about these things at the dinner table. And also it can be a family problem, right? So what's normal for you may not be normal for the typical population, but you don't know any different as a parent. And so you're like, well, it seems fine.
Right. So what are some ways we can help avoid constipation in our kids?
Yeah, there's lots of really easy ways. So again, adequate hydration, adequate fiber in your diet. So it's your child's age +5 in grams per day. So if they're 5 years old, plus another 5, so 10 grams of fiber divided across the meals in the day, up to kind of 15 gram maximum. But again, if you're doing a normal diet, you're likely hitting that. So it's not pushing it above and beyond that. Exercise can get your gut moving. We know that when you move your body, your gut gets moving and so is more likely to poop. Having good toileting hygiene. So sitting on the toilet with your feet elevated, with your knees above your hips, can be really helpful for constipation management. And sitting on the toilet, even when you don't think you have to go, just to allow your body time to relax and see if you have an opportunity to eliminate. So that's the basics. And then if it persists above and beyond that, talking to your doctor about ways to manage constipation. I know oftentimes families want to try and solve it with other things, like they'll add fruit juice or prunes or all the things. And if those aren't working, that's totally okay. That doesn't mean you're failing. It just means your child may need a little bit more help. And so you need to talk to your doctor about other options for treatment.
Okay, so don't necessarily start Maalox right away until you actually talk to your pediatrician.
Absolutely. Yeah. And so Miralax is the thing that kids most commonly.
Yeah, I said Maalox, but
that's okay. It's another GI med.
I have a lot of GI issues, so I know all of these.
Yeah, Miralax is one of the most commonly used medications and often started by pediatricians. And it, I think, can be a great option for treatment for this problem in kids. And you'll just want to talk to your pediatrician about what's right for your child. And don't feel like if you tried Miralax and it wasn't sufficient, there aren't other options, because there are.
Okay. So this might be kind of a 2-part question, but let's say you've talked to your pediatrician, you've tried some of the things that they recommended and still not working. The 2-part is, when do you know to ask to go to the GI clinic? And like, what harm, like how long, should we wait before it causes more harm?
Great question. So I would say if the child's been struggling with constipation and the first line treatment, so whatever your pediatrician mentioned, hasn't kind of resolved the symptoms within a month or two, it's totally appropriate to ask for a referral to a GI specialist. And doctors are often very willing to do that. And it's very
Sure.
easy to self-refer to do that. The second part of that is, so you were asking about when to go and then what is the harm? Is that the second part?
Yeah, like what are some things I guess we want to avoid?
Absolutely. I am very much a proponent of early treatment of constipation because the downstream effects can be really not so pleasant. So you can also see new onset of wetting. Your child was dry and then now they're having wetting accidents. You can see onset of incontinence, so having poop accidents after being toilet trained, which is really frustrating for kids and their families. You can see lots of belly pain. You can see decreased appetite. All of those things could be evaluated by a GI specialist who would do some basic medical workup if indicated to make sure that you're not missing anything like celiac disease or Hirschsprung that could be contributing to this condition and we didn't even know.
Okay. And are there any, like, can you self-refer or do you have to go through the doctor for that, your pediatrician?
I think it kind of depends on insurance.
Okay.
The different insurance plans kind of dictate that. I think pediatricians are always a great first step because they are very comfortable in managing straightforward constipation. Now, if your kid's tried lots of treatments and hasn't had a lot of effect, they are more than willing to refer over. And then we have multiple clinics within Children's Mercy and other places. So you have general GI, which is just any gastroenterologist who often can get you in sooner. There is our BRIC clinic, which is just about constipation, so bowel retraining and constipated kids. Or we have our ICI clinic, which is for kids who have chronic and refractory constipation and soiling, which is myself, a psychologist, as well as a nurse practitioner. So you go get both the medical and the behavioral piece.
Wow. So even more specialty beyond the GI specialty. Okay.
Absolutely.
That's excellent. I will say, moms, something I recommend, and I think the doctor would back me up here, is, advocate for your child. If you feel like you're not getting the answers at the pediatrician, like ask for that referral. Don't be afraid. You're not crazy. The people at Children's Mercy, will welcome you. And, even if it's nothing, they're fine with it. Like this was 12 years ago, so things have changed. But when my child had acid reflux, the doctor kind of pushed me aside and was like, babies cry, babies spit up. And I was a first-time mom and I was, 9 months in and I was like, no, something is wrong. And I know it's wrong. So, advocate for yourself and your child to get that, specialty referral if you need it.
100% agree. And our medical model's kind of set up to ask what's wrong. Right? Like it kind of perpetuates this idea of like, what's wrong? What do we need to fix? Which sometimes we do. And then sometimes it's okay, we've done the workup. It looks good. That's great news.
Right. Definitely. And I will say one of our contributors just wrote a blog post that we'll publish this week about her experience with the GI clinic and her daughter and constipation. So we've got a whole series for you guys this week that we're highlighting this. So hopefully this was helpful. We thank you so much for your time. And I just wanted to say that besides constipation, the Children's Mercy GI Clinic also provides excellent care for children with intestinal, liver, esophageal, and nutritional disorders. And they treat kids from babies to teens. So a great resource we have in Kansas City. So thank you so much for your time.
Thank you so much for having me.